during the thyroid operation, a nerve which is crossing a vessel has been found. What is this vessel? Superior thyroid artery. So what is that nerve which is accompanying the superior thyroid artery, doctor? External laryngeal nerve. That is the one which ultimately goes and supplies the cricothyroid, is what you have to basically remember. That is the reason there is a development of a paralysis of cricothyroid muscle. What is nerve of Rysberg? What does it basically contain? It contains two components. One is it has got the sensory fibers and it has got the parasympathetic fibers. It is the part of the facial nerve which is located in the motor component of the facial nerve and the vestibulocochlear nerve, and it contains the sensory and parasympathetic fibers. Now doctor, this is Bell's palsy, which is a lower motor neuron type of facial palsy. Can the online students can punch? Sadila says, paper is very tough, sir. Yeah, we want to be tough with you, so that we want to depress you. Honestly, we want to stimulate you, and till morning 5:30 we are in the process of doing that, setting up a question paper for the today's exam. Actual exam is about 15-20% more diluted than this, but you cross at least 130 marks in this paper, you are a good student. Today's paper, I mean, your preparation is great. Every student is good. Preparation is great. It is at a good level. That's what I can say. Yeah. So all these are lower motor neuron, but lacunar infarct typically lead to upper motor neuron with the sparing of the upper part of the face is what need to be remembered. So what does roof of inguinal canal basically contain? It contains the internal oblique. So you need to know the margins. What is the floor? What is the roof? What is the anterior wall, posterior wall of inguinal canal? Any entrance you go, PGH, Chandigarh, AIMS, or any exam, this is going to be the question. A person has a difficulty in opening the mouth but not in closing the mouth. This is a classical story of which muscle, doctor? Lateral pterygoid muscle. So the lateral pterygoid depresses the mandible while opening it. Then it inserts into the anterior margin of the articular disc and it is supplied by the mandibular nerve, is what you have to basically remember. So what is not found in semen? We don't have inositol, but we have a fructose, spermine, prostaglandins. They are all the components. Then in amniotic fluid, we find the presence of the glucose. So you must know the constituents of it. If you take the shear stress of the vessel, typically it is parallel to the long axis of the blood vessel, not perpendicular to the long axis of the blood vessel, is the point of interest in this. The carbon monoxide transfer factor. What are the conditions that increase the carbon monoxide transfer? Obviously, more amount of hemoglobin, if it is there, carbon monoxide binds with that hemoglobin. Polycythemia is a condition where you have got a higher amount of hemoglobin. Similarly, if there is a left to right, not a right to left shunt, yeah, so it is the polycythemia, not anemia, is what we need to appreciate. Now coming to arterial BP, diurnally it will be varying. Exercise increase both systolic and also diastolic BP. It will be high if you use a small cuff. A smaller cuff will artificially inflate the BP, is what you need to appreciate. Which is not a sphingolipidosis but a gangliosidosis out of this. If you take the Sandhoff's disease, but before that, what are the various enzymes in various sphingolipidosis is one of the favorite area of examiner. Gaucher, U is big, no? UC, Gaucher in the spelling. So beta glucosidase. Fabry is basically alpha galactosidase. Both of them here are AL. Niemann-Pick is sphingomyelinase, and Tay-Sachs is TSH. H is hexosaminidase. Some way to remember, but that is the dirty part of the story called entrance exam. You can't say I am brilliant, I read Harrison. No one cares. If you don't know that alpha galactosidase is Fabry, you will be killed and not even made available for autopsy in the competition. That cutthroat is competition. So be sure, in addition to intellectual aspect of the preparation, also try to fine tune the donkeymanship of the preparation. That also have a 200 pages book and get ready and mercilessly face the exam. So what is this diagram illustrating? Leucine, isoleucine, valine, which are the branched chain amino acid abnormality. So that is the reason it is depicting maple syrup urine disease is what need to be remembered. Similarly, isovaleric acidemia is one more condition which is branched chain amino acid abnormality. One question will come, doctor, you like or you don't like. Gluconeogenesis, glycogen synthesis, glycogen breakdown, glycolysis. What are the rate controlling steps? How are they regulated? Fatty acid synthesis, what are the allosteric enzymes? Those 8 to 11, I think 11 cycles are there, metabolic cycles. So please be sure. So if you look at the gluconeogenesis, that is production of glucose and release into blood plasma. That capability is only there for the liver but not for the muscle, because the muscle does not have the enzyme glucose 6 phosphatase. In order to break down the glucose 6 phosphate into glucose and release into blood, you require glucose 6 phosphatase. That is not there in muscle but only there in the liver, is what you have to basically remember. That's the reason liver only can contribute to the blood glucose. Liver dysfunction lead to hypoglycemia in the alcoholics, etc., etc. Now doctor, regarding the urine odor, which urine smells in what way, you need to be sure. Phenylketonuria is mousy odor. Hawkinsinuria, what is it due to deficiency of? Hydroxyphenylpyruvate hydroxylase deficiency. You will get a swimming pool odor. The chlorination smell will be there, no, in the swimming pool. That odor will be there. Thyroxemia will give a rotten cabbage like odor, is what you have to basically remember. If the adenine is 23%, what is the guanine which is present? So you all know the calculations, Chargaff's rule. Adenine is 23%, so thymine is 23%. So guanine and cytosine combined is 23 plus 23, 46. 100 minus 46 is 54. 54 divided by 2 is 27% will be the other two, guanine and cytosine. Didn't get? Got it? Adenine is equal to thymine, guanine is equal to cytosine, because adenine binds with thymine, guanine binds with cytosine. So 4 of them constitutes 100%. So 27 plus 27, 54, 100. So I hope you all understood. You are looking very exhausted. Oh, 3 hours, 1 hour waiting for the teacher to come to tell the things that we already know. I know you are all exhausted. अगर हो सके तो एक राउंड चाय हो जाए, हाँ? Just please ask them to call the, if there is any tea guy is available. Our doctors are, yeah. Suresh is saying among the online students, at least we need this kind of electroconvulsive therapy once in a week, sir. He did not say electroconvulsive, I am adding that. So this kind of paper is needed at least once a week, so that we will wake up. So Raj is saying no voice, please ask whether the voice is coming or not, please check. Yeah, it's coming. Yeah, Right. Now, is the volume is fine? I hope online students the volume is fine. Now regarding DNA polymerase usage in polymerase chain reaction, you basically get it from a virus, and the remaining is wrong. You don't get it from virus. Remaining things are all right. It is heat stable. It will add a nucleotide, and it is obtained from bacteria. They are all the correct things. Which vaccines develop from embryonated eggs? Typically, influenza, rabies, and yellow fever are the ones which are those who have egg allergy. You need to be careful to administer these things. Not the CMV is what you have to basically remember. Disorders of phagocytosis. I told you last week, one question will come from Chediak-Higashi, Job syndrome, lazy leukocyte syndrome, chronic granulomatous disease, combined variable immunodeficiency, all immune deficiency. 2 pages in Anantanarayanan. I hope you all have read that. Wiskott-Aldrich is not a disorder of phagocytosis. Whereas Job, Chediak-Higashi, Tufsin and myeloperoxidase deficiency, they are all called the disorders of phagocytosis is what you have to basically remember. Sterilization of the surgical instruments. How do you want to basically do it? You can do that using hot air oven, autoclaving, glutaraldehyde, not ethylene oxide. Once more, if you go through the previous microbiology questions of APPG, I think recently on Monday we had a wonderful class of last 20 years of microbiology MCQ review by Dr. Khalil, right? So tomorrow you are all coming, morning 10 to evening 7 p.m. we are going to finish some more remaining questions in APPG. Last 25 years is still not over in spite of finishing 2 classes. Then we have Tamil Nadu PG around 302 questions last 25 years classified, and that is also a worthwhile question bank to see. So we will try to finish because we have a large number of students in Tamil Nadu waiting for it. So please do come tomorrow, and when we review Tamil Nadu PG question bank, once more the high yield topics, those which we have done in APPG and DNB will once more come back. So that is the reason until exam we are jobless, and we will give you company. So don't worry, whenever you feel like using your ears, come to us, using your eyes, go to reading room, but use ears and eyes every day with the same dream in the heart, carrying it, go to the reading room, that I am joining the dream post graduation just in another 100 days, just in another 100 days, right? So be sure. So about Hetch influenza, what is the true statement? Typically out of all this, is it false or true? True only, right? So it is typically often isolated as a capsulated strain. Klebsiella is what need to be remembered. Then Klebsiella, Pseudomonas, Staphylococcus, Streptococcus, Proteus, totally 12 organisms. Which ferments glucose, which does not, which is indole positive, indole negative, what is Vox proscoisus reactions, positivity, negativity, all this culture stuff. You must be ready, doctor. Sulfonamide allergy. What are all the other sulfur drugs that you know? Brinzolamide, bumetanide and acetazolamide, they all belong to the sulfur group. Isoniazid is acetylation, ethambutol is bacteriostatic, and drug transport, if you say, facilitated diffusion is a carrier mediated, which is true. Facilitated diffusion do not need energy. Most common method of transport is definitely passive diffusion. Now what, out of all this which has both beta and also alpha 1, what will alpha 1 will do? Alpha 1 receptor stimulation will lead to vasoconstriction, and blocking that will lead to vasodilation, and that will help in treating the hypertension. So carvedilol, labetalol, they have both alpha and beta blocking effect is what you have to basically appreciate. Pilocytic astrocytoma is slow growing, and it has a high vascularity and involves the cerebellum, and unlike glioblastoma multiforme is another variety of astrocytoma. Astrocytoma and glioma are same. Gopal, Gopala, Madhava, Krishna, Govinda, like that. Glioma, astrocytoma, all same terminology. Glioblastoma multiforme is worst kind, pilocytic astrocytoma is the best kind. Generally it is very benign, is what need to be remembered. It belongs to grade 1 type of a one. So what do you see here? Penile papillomas, which are HPV related. So HPV can lead to oropharyngeal cancer, cervical and also esophageal, but not Burkitt's lymphoma. What do you see here? Reed-Steinberg cell. Other than the B-cell lymphoma, where else do you see it? Infectious mononucleosis, adult T-cell lymphoma, but not in case of the marginal zone lymphoma will not show the presence of the Reed-Steinberg. There are some specialities for marginal zone lymphoma. What are the CD markers and response to the chemotherapy? Marginal zone lymphoma is a class apart among lymphomas. Okay, doctor. If you did a question wrong, this question wrong, lymphoma question wrong, lymphoma, leukemia, top 100 rankers will not do wrong. Right? Take it as my word. There are some topics, top 100 rankers are not supposed to do wrong. Right? So, you should not do wrong. If you did wrong, you read after going home, leukemia, all lymphomas, both pathology, medicine, pediatrics, all the three places ek bar round mark ke 200 pages book mein special points likh ke be ready. Definitely one question will come and that one should be right. Adipocere formation. If the body is buried in moist soil, not in the dry soil, there will be a saponification leading to that waxy adipocere is what need to be remembered. So, offensive smell is a true statement, no? In adipocere, due to the saponification, dalda or a putrefied or for that matter ghee or dalda, will it give smell or not? So that is saponification. So what do you see in this abraded collar? Around the wound there is a abrasion collar. See, always carry your smartphone, you will be given a link, check in that, all images will be put in that, there you will have clarity. So abrasion collar is a indicator of firearm entry wound. Firearm is a high yielding topic, doctor, in forensic, no compromise. So whenever a entry wound happen, typically that entry wound will leave a small mark around the point of entry, and that mark is basically abrasion collar, which is a mark of entry, is what need to be remembered. For the blood stain, what is the confirmatory test? Spectroscopic test. Once more, doctor, a stains, blood stain ke andar blood group of that stain, so seminal and blood stain in forensic, favorite area. So you need to review that. Quadrivalent vaccine of HPV contains 11, 16, 18 but not 7. Basic question. Millennium Development Goal, this is the last year where they will ask. So still, so there are some goals. How much mortality should be decreased, how many medical colleges should be increased, how many PG seats must be increased, all are there in the Millennium Goals. So expert MTB RIF test is used for what purpose? To know the RIF is rifampicin resistance. We will be using the expert MTB. RIF is a cartridge based automated diagnostic test that will identify the Mycobacterium tuberculosis is what need to be remembered. Rajalakshmi from Chennai correctly asked a question. Sir, Jobs is hyperimmunoglobulinemia. How can it be a syndrome of phagocytosis? For the phagocytes to eat the things, who stimulates them? Interleukins. So those interleukin production is associated with whom? Functionality of the cell-mediated immune cells. So any cell-mediated immune cell dysfunction in turn will affect the macrophage functionality. That's how it falls under the disorders of phagocytosis is what you need to appreciate. Now, drinking water quality. Is color more than 15, chloride is 200 to 600, turbidity is, there are about 7-8 standards, doctor, drinking water. So you have to be sure on remembering each of them very clearly. Definitely one question will come. Huh? Color guideline value is up to 15. Is up to 15 true color units. More than 15 is there, you want to say? PHC, oh sorry, in that case A must be answered. So one small correction, correction of, hope the online students, online test is okay, I hope so. Hope the options were not repeated, we had a little problem earlier. Yeah, Rahul rightly said B is a right one, correction should be on, answer should be A, yeah. To call multibacillary leprosy, skin smear, skin lesions given are the correct numbers, but not the eye lesion is included in the defining process of the multibacillary leprosy. There is 10,000 population, 500 diabetics. A new diagnostic test shows 350 are true positive, false positive are 1900. What is prevalence, sensitivity, specificity? First, prevalence is straightforward. 500 out of 10,000. 5% katam. Then what is meant by sensitivity? Sensitivity is true positives by all the people who are diseased. 350 by 500 into 100, that becomes 70%. Then the challenge is how to detect specificity. So how to calculate specificity? What is the numerator in specificity? True, negative. So true negative plus false positive is what? Not diseased. So if 500 are having diabetes, how many are not having diabetes? 10,000 minus 500 is 9,500 is equal to true negatives plus 1900 was given as what? False positives. So true negatives plus 1900 false positives. So how many became true negatives? 9,500 minus 1900, and that is 7,600. So specificity is this 7,600 divided by all the people who are not diseased. That is 9,500 into 100, that become 80%. So that comes the answer. Third part calculation only thoda mathematical, but let me tell you, positive predictive accuracy, negative predictive accuracy, there are two formulas relating them with sensitivity specificity. 1 minus sensitivity, 1 minus specificity, that formula is there, no? वो दो formula पढ़ना और sensitivity and specificity formulas भी पढ़ना. And what is the meaning of true negative, false negative, true positive, false positive? Examination में जरा देख लेना. And if your calculations are more than one full page, if you are continuing to calculate and it is coming as 31.6876, that means you have somewhere gone wrong. Right? It won't be like that. It will be a full number, right? So, but let me tell you, if you did this question wrong, top 100 rankers won't do wrong. That is that kind of question. Okay. There are some questions where top 100 will also do wrong. There is another classification available, right? So, tuberculin test. Tuberculin is not the only way, because tuberculin test is not diagnostic test. It only is a prognostic test which tell how efficient is the cell-mediated immunity is what you need to appreciate. Von Willebrand. In von Willebrand disease, what is the problem? Von Willebrand factor is also required for the stability of factor 8. So if factor 8 is unstable, it leads to APTT prolongation. Von Willebrand is a functional disorder of platelet, not absolute low platelet count. So platelet count will be normal. The most common inheritance pattern of von Willebrand is autosomal dominant, not recessive. Once more, I told you last time, last exam, von Willebrand disease, how many subtypes are there? Where will you use desmopressin? Where you should not use desmopressin? And what is the inheritance pattern of type 1A, 1B, type 2, type C? All those things you should be sure. 18-year-old admitted with abdominal pain which is intermittent, which is periumbilical with non-bilious, non-bloody vomiting and blah blah blah. And perioral hyperpigmentation is there, and there is what? Intussusception which is being shown. So what is the cause of this condition? This is Peutz-Jeghers syndrome with hyperpigmentation with a hamartoma which can lead to intussusception with an abdominal pain as a clinical presentation. So what is the true statement in this? It can present like anemia in children. They are not adenomatous polyps, but what are they? Hematomatous polyps is what need to be remembered. Now doctor, this is how the histology of a hamartoma. Hamartoma is fundamentally a disorganized tissue. That's the point you need to understand. Once more. How many people did earlier lymphoma question wrong? Just for a small 5. Okay. How many did this question wrong? The same 5. Okay. Same 5. Anybody added where earlier did right and this wrong? I am trying to do a randomized control trial on how you are prepared. That is most important, doctor. See. Every day of teaching, it's an experiment. How to make you read less, still get a good rank. That's the whole purpose, no? You are coming here or we meeting you, right? So that will help me. What are those factors that create a tardiness in revision? I know. Lymphoma leukemia is the worst painful thing to open, that too 100 days before entrance. First time if you are doing it. Assuming that there is a big ocean of things to read in that. There is not really an ocean. 6 varieties of lymphomas, 4 varieties of leukemias. 10 varieties, each has got 8 to 10 points. 100 points is lymphoma leukemia story. But that 100 points will give you 1 mark, assured 1 mark. So you should read, okay, after going home. So 11-14 translocation, BCL protein 3 overexpression, CD5 positivity. But what is the specialty of mantle cell lymphoma? Huh? Mantle cell BCL 1 or 3? वैसा कुछ फंडा है क्या? BCL1 protein is there, which is also called cyclin D1. Oh, that brings B and C, D, both of them become wrong, no? Okay, assume it is 1, but what is the funda about centroblast? Unlike other lymphomas which show centroblast, mantle cell lymphoma does not show centroblast. Sorry for a wrong option. Option B need to be edited. Very good. So very happy to see 70 online viewers on this Wednesday evening. Wow. Sitting in the home with the furnace on the side of them. No need of traveling in a smoky traffic, with a seamless delivery of the class. That is the beauty part of technology, and that is the future. So AST 313, ALT 103 and gamma glutamyl transaminase 44. What is your diagnosis? So basically you need to look at AST versus ALT. If the AST by ALT is high, then that is an indication of alcoholic hepatitis, which is a very classical feature. AST selectively increases is what you have to basically remember. Aplus syndrome, what will happen? There is a recurrent abortions, both arterial venous thrombosis. Aplus syndrome, you have a phospholipid antibody in the blood. In such people, if you want to do APTT, that antiphospholipid antibody will cross react with the APTT test and artificially cause a prolonged APTT. So there is no real APTT prolongation. That's the reason prolonged APTT will be there, but INR will not alter because of the antiphospholipid. 28-year-old dies with massive hemoptysis and direct immunofluorescence of the kidney shown. So what do you have in this? Linear immunoglobulin deposition like a ribbon-like pattern, which is a feature of good pasture syndrome, is what needs to be remembered. It is a type 4 collagen, pulmonary hemorrhage, crescent formation, and it is the basement, it deposits on the basement membrane. It is not subendothelial, is what you have to basically understand. So there, point mutation. Which one is caused by point mutation? Cystic fibrosis is a classical thing which is due to a single intron. Intron or exon? Which is the replicating part? Exon or intron? Exon. So it is a mutation in exon is point mutation. Sickle cell anemia, thalassemias, they are all examples of that. But not colon cancer, diabetes, they are all not point mutations, luckily. Proto-oncogene. Proto-oncogene is activated by virus, not inactivated. That's how viruses can become oncogenic viruses. Beta thalassemia, HbF levels increase. Because what is the composition of HbF? Alpha, but not beta. That's the reason whenever beta is defective, other hemoglobins will basically increase. Regarding mitochondrial inheritance, only the mother can give to the child. If you take the mother's egg and dad's sperm, sperm only gives the nucleus. Cytoplasm is contributed by, at the time of fertilization, by the egg. So mitochondrial inheritance is from mother to the child. Regarding AFP level, what is the wrong statement? Upper limit in the serum is 20 nanograms per ml, not 200 nanograms per ml, is unfortunate truth. You have to agree after finishing exam and coming out. But this question, if you did wrong based on the 200 or 20, don't worry. We don't expect you to be such insanely obsessive. Whoever wants tea, please raise the hand. He will serve the tea. Yeah. Is what you need to basically remember. Then 18-year-old bilateral loin pain, macroscopic hematuria, sore throat started one day earlier, and his physical examination is showing lot of palpable purpurae, which is a story of Berger's disease, IgA nephropathy, henoch-Colin purpura, whatever the name you like to call it as. What is except about this condition? Proteinuria absence is not a pathognomonic feature, all the remaining things are true. Polyclonal IgA proliferation will be there, mesangial deposition of the IgA will occur, they are all true statements. Acute pancreatitis. Fundamentally, nasojejunal feeding is better rather than total parenteral nutrition is a true statement. CT is the best imaging modality. Ultrasound only will give you a swollen edematous pancreas. It won't confirm you the diagnosis of pancreatitis or the extent of it. Balthazar scoring of pancreatitis is there, no? So that you need to be very sure. Enteric nutrition typically has got a less chance of spread of infection than parenteral nutrition. Parenteral may infection is much more higher is what you need to remember. Regarding esophageal adenocarcinoma, incidence is increasing because of our sedentary life. Continuously we have to sit in the reading room and study. In the middle we will go and in KFC pick up a burger to eat and once more come and study. We will get sick by the time we become atrociously obese, and that lead to increased abdominal pressure which lead to reflux, and that lead to Barrett leading to adenocarcinoma. So don't study that much, because you don't need to study that much. Be very sure. If you are studying too much also, remember, if you are studying beyond the human capacity, also means you are not preparing for entrance, you are preparing for PhD. Entrance preparation means every moment is enjoyable, doctor, let me tell you. First reading a topic, then in that topic you will have few forgettable facts. What is Fabry, what is Gaucher, etc. Capturing them, how to remember back when they are asked as questions. By the time you keep doing this iteration and then build up your 200-300 hours of preparation, automatically any entrance you go, you will get seat. Without an orientation, reading entire pediatrics textbook means nowhere, you are nowhere in competition, because you won't retain all that, right? So, what is wrong about congenital nephrotic syndrome? It is also called Finnish variety of nephrotic syndrome. It will occur even in embryonic life only, it won't wait until first month. So that is the reason whenever if there is any renal dysfunction in embryonic life, it will alter the amniotic fluid formation. So you will recognize the presence of the nephrotic syndrome right in the embryonic life. At birth only it will be there, is what you need to remember. It is caused by NPHS1, nephrin is the key component, it is steroid resistant. They are all the facts about the congenital nephrotic syndrome. Then doctor, up to what age nocturnal enuresis is normal, boys and girls? 7 years boys and girls is 6 years is considered to be a normal limit. A girl lost her father, very depressed. If it were to be son, he would have not been depressed. Definitely. A girl lost her father, which is a real story. So, pathological grief when you call it as. If the sadness is continuing until she lost her husband also. So, if that much long, if the sadness is there, more than 6 months you call pathological grief, right? So, when do you call pathological grief in PG entrance results? State entrance results nikalte hi, generally you will think now a fear of impending doom. That day notification, another day exam, after that the result, and you will suddenly will be sleeping NREM stage 2, then you will be kicking your roommate, stating that, and you will be biting also, stating that oh, I missed it, my rank is not 100, it is not 1000, it is 10,000, you got a dream. Then after that how long can you cry? That also planning should be there, right? Maximum 2 days, doctor. 2 days. Buy five handkerchiefs. Throw. Total weight of cry should not be more than 500 ml. Right. After that, once more DNB will be in June. AIMS will be in June. PGI is in June. Your fiancé is waiting for you to marry you in June. So that is the reason. Don't cry if you lose, or don't worry now about what to do after you lose. Anyway, after losing you are going to marry, we are sure. So it is more than 6 months. Then what is this investigation? It's called invertogram. Whenever anal atresia is there in a newborn baby, you will be doing it. So when will you do the invertogram? Within how much period of time? After 6 hours, where the gut gas collects is the typical benchmark. In the ultrasound, what do you see? Target sign of intussusception is what you are seeing. So what is it because of? Submucosal lipoma predisposes to intussusception. In sentinel lymph node biopsy, intercostobrachial is the one which is often injured. Coming to cholelithiasis, to be radio opaque, unlike the kidney stone, gallstones are all radiolucent most of the times. So 10 to 20% of the stones only will be radio opaque is what you need to appreciate. There was an operative cholangiogram which is being shown to you. Don't even look at the cholangiogram. You can't anyway make diagnosis about cholangiogram because you don't know how to differentiate between a real bile duct and the endoscope tube also. Our life is that innocent. Depend on your entrance wala basics only. Fever, chills, pain, jaundice. Typically combination is suggestive of cholangitis. So cholangitis is commonly due to what? Gram negative organisms, not gram positive, is what you have to basically remember. Carcinoembryonic antigen is what? Yeah, very good. Kishore asked a very good question. Tobacco leads to squamous cell carcinoma, sir. Then why adenocarcinoma tendency is increasing? Tobacco causes squamous cell carcinoma, but nowadays we are afraid to smoke and afraid to move from where we are sitting unless somebody pushes us out of the chair. So that is the reason adenocarcinoma tendency is increasing overall. That's the point. So doctor, carcinoembryonic antigen is not just specific for colon cancer. There are X number of conditions which can make it to increase. After surgery on the right side of the neck, due to remove the lymph node, patient is not able to raise the arm. So classically there is a paralysis of trapezius which is required to raise the arm above overhead. A person is unable to dorsiflex the foot and loss of sensation on the dorsal foot. It is a common peroneal nerve at the neck of the fibula which is classically associated with that injury. Once more, common peroneal, tibial nerve and once more disc prolapse also. L3, L4, L4, L5, L5, S1. What is the difference? At which level what jerk is lost? All these things you have to 100% sure, doctor. So what do you see in this condition? Ectopia lentis. So ectopia lentis is a feature of Ehlers-Danlos, homocystinuria and sulfite oxidase. All this will lead to the development of ectopia lentis is what you have to basically remember. About the accommodation, the elasticity of the capsule definitely has a bearing on the accommodation, which is a true statement. I think, doctor, correct way is it should not be true, it should be false, and answer then should become a small mismatch, because it is produced due to an increase in curvature of the antral surface. Oh, even C is wrong, no? So true only is the right thing. True only is right thing, no change is required. D only is the correct answer. Okay, agreed. What is wrong about ciliary body? It has got a pars plana, pars plicata, aqueous humor production, long posterior ciliary artery, not short one, is responsible. And where is it basically located, doctor? It is located around 1.5 mm posterior to the corneal limbus in the horizontal meridian and 2 mm posterior to the vertical meridian is what you need to basically remember. Now coming to the bacterial infection, hypopyon ulcer is fundamentally bacterial. Nasolacrimal obstruction generally occur at the level of the valve of Hasner. Then what is the wrong match? Myotonic dystrophy lead to Christmas tree pattern. Remaining are all true. Emidaron lead to anterior subcapsular, radiation lead to posterior subcapsular, Alport syndrome lead to posterior lenticonus, and Wilson is sunflower. Huh? What is anterior lenticonus? Alport. Alport is, I'll check that. Option B, we will check. Just somebody please make a note of which questions need a correction. Yeah. What is this laryngoscopic view showing? It is showing HPV, papillomas, laryngeal papillomas. So where are they very common? Anterior commissure. A evangelist in church who uses his voice to spread the message of the God has developed nodules on the vocal cords called singer's nodules. So where are they very common? Anterior 1/3 and posterior 2/3 is the most vibrant part of our vocal cord where they are very common. Benign positional vertigo. It is a disorder of posterior semicircular canal classically, and the age group is mismatched among the options. That is, second decade is not the age. Huh? Yeah, see? I mean, you are convinced about answer D, any correction you are looking for? All, huh? C is Halpic maneuver is not helpful in diagnosis. It is helpful in diagnosis, no? To differentiate the benign positional vertigo from the central vertigo, there are 2 to 3 methods of differentiating, which will have latency, which will have a vanishing and Halpic's maneuver, etc., etc. What is this laryngoscopic finding showing you? Bilateral recurrent laryngeal nerve paralysis, which is bringing 2 vocal cords to a central position, right? And that typically happen whenever you do thyroid surgery. If you are a brilliant surgeon, not 1 recurrent laryngeal, 2 recurrent laryngeal you will injure, right? Then what do you see? Carot's notch is what you are seeing. At the 2000 frequency, there is a dip in the audiogram, right? So otosclerosis is what we are handling here. If you do the successful stapedectomy, what will happen? Audiogram becomes normal. Actually, option B also is little tricky. Worldwide it is females and in India males. Even A is correct. So A, B, C are correct. So except laga ke D should be made the answer. So one more correction, doctor. So most common location for nasal hemangioma, nasal septum is the most common location. So what is this patient having basically? Cavernous sinus thrombosis. And what is the way that spreads there? Pterygoid plexus, facial vein, and ophthalmic vein will carry the infection into from the dangerous area of the face to the cavernous sinus. Material serum AFP is increased in neural tube defect, omphalocele and sacrococcygeal teratoma in all these conditions. So that is the part of the story.